Hi, welcome to this hair care initiative by IPCA. I'm Mona Sharma. It's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Priya Kumari Jha is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS, MD and specializes in dermatology, cosmetology and trichology. She is currently practicing as senior resident in West Bengal Medical College in Department of Dermatology, Kolkata and attached to Roma Health Clinic and Skin Aesthetic Clinic, Kolkata. She's Dr. Priya is also aware of the need for the patient education about hair care and hence spend a lot of time in giving talks at various platforms from across the country. Thank you so much, Doctor, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to this
Thank
hair
you.
care initiative.
Thank you, Mona, for the introduction.
Doctor, today we are going to talk about hair care in current scenario. So, whenever we talk about hair care in current scenario, the very common problem which is faced by all of us is hair loss. So, can you please enlighten us today with your profound experience, like what's normal and when to be concerned for?
See, normally hair has a normal life cycle of hair consists of four stages: anagen, catagen, telogen, and exogen. So, two of the most important stages are anagen and telogen. Anagen is the growing stage, and telogen is the resting stage. So, what we call abnormal is when there is early transition or premature transition of anagen to telogen. So, when this is the stage where premature or excessive or abnormal hair fall occurs. So, what is the normal count of hair which will bound to fall off physiologically is 60 to 100. Above 100 is what we consider abnormal. In spite of this, some special conditions like if you are observing more than normal hair over your comb, over your pillow cover, or if you are seeing receding hairlines or patchy baldness, there is one condition called alopecia areata where there is bald patches are formed over the scalp. So these are the condition. If your hair is falling like less than 100, then also you have to consult trichologist or dermatologist to treat such conditions. So yeah.
Okay, so whenever like hair is everywhere and it's more than 100 and
Yeah, yeah.
everyone at home is complaining like गिर रहे हैं तुम्हारे बाल, so that means you should go to the doctor instead of
Yes, yes.
avoiding it for longer time.
या
Okay.
आपके नॉर्मल ट्रेंड से ज्यादा जब अगर आपको लगे कि मेरा नॉर्मल ये था अब मेरे को थोड़ा ज्यादा हो रहा है तो या
Mhm.
आपको आना पड़ेगा.
Yes, doctor. That's very interesting, doctor. So, doctor, now that we know what's normal and क्या alarm sign है जिनको हमें ध्यान रखना चाहिए, तो another very common question people who are prone to hair loss, they keep asking themselves कि मुझे ही क्यों हो रहा है and what are those causes, ये क्या हो गया मुझे? So, can you please enlighten what are those general causes of hair loss?
Uh, First of all, hair loss is what we call alopecia. It's
Mm-hmm.
divided into two categories:
Mm-hmm.
non-scarring alopecia and scarring alopecia. So, what we are about to talk today is non-scarring alopecia, which is the most common cause. So,
Mm-hmm.
in non-scarring alopecia, the most common cause that I encountered is nutritional deficiency. Nutritional deficiency, like mostly in Indian scenario, mostly in female, what we get is hemoglobin deficiency, when the decrease in hemoglobin count, iron deficiency, and vitamin B12 if the person is vegetarian, then vitamin B12 deficiency, vitamin D deficiency. So all this comes under nutritional deficiency. देन सेकेंड मोस्ट इम्पॉर्टेंट लाइफस्टाइल. लाइफस्टाइल भी आपके न्यूट्रिशन को इफेक्ट करता है. अभी क्या है, हम लोग प्रोसेस्ड फूड, जंक फूड, फास्ट फूड ये सब लेते हैं. तो बिकॉज ऑफ दैट व्हाट हैपेंस, आवर बैलेंस डाइट गेट हैम्पर्ड. So the hair don't get the exact amount of nutrition what it required, and then after 3 to 4 months it falls off. Third is
Mm-hmm.
stress. Stress can be of two types: psychological stress, physiological stress.
Yeah.
So, physical stress, sorry. So, what is psychological stress is mental stress, obviously. Exams hai, work pressure, if you are not sleeping right, then
Hmm.
in such condition, we can also experience hair fall. Second one is the physical stress. Physical stress is like if you meet an accident or you are having some disease infection, high grade fever like dengue, typhoid, malaria, COVID. In this condition also, after these are acute stress, and after a span of 3 to 4 months, there here we what we get is telogen effluvium. Okay, so 3 to 4 months के बाद एक sudden increase in the amount of hair fall person experiences. Then third one is the hormonal cause. Hormonal cause में first of all, like today polycystic ovary disease is very common. So polycystic ovary disease, hypo or hyperthyroidism,
Hmm.
uh, postpartum, when there is
Hmm.
withdrawal of estrogen and then female experience a sudden increase in hair loss. Menopause. In menopause also a female experience sudden increase in hair fall. Then fourth one comes the genetics. Genetics play a major role in pattern baldness, especially in male pattern baldness. What we get in male pattern baldness is the recession of hairline, temporal recession. There is clearing over the vertex crown area. So in such condition, genetics play an important role. And nowadays we are observing there is early aging of the early at the early stage patient experiencing male pattern hair loss. Like patient बोलते हैं कि मेरे फादर का था पर 35 के बाद हुआ था, मेरा 25 में ही हो रहा है. तो यहाँ पे क्या होता है कि यहाँ पे काम आता है एपिजेनेटिक्स. इसमें क्या है कि आपका लाइफस्टाइल कैसा है, आपके फादर काम करते थे, हार्ड वर्क करते थे, घर का खाना खाते थे, बैलेंस डाइट खाते थे, आपका लाइफस्टाइल अलग है. फिर लाइफस्टाइल में स्मोकिंग, अल्कोहल, your sleep cycle, all this comes in lifestyle. So yeah, all these causes mostly I encountered in current scenario as a cause of hair loss.
That's very informative, doctor. So now, doctor, अब इतने सारे causes हैं. In fact, the lifestyle is also playing so much
Yeah,
big
yeah.
role in our life, and actually we are like totally busy and not paying attention to that, and we lead to this hair loss problem. Now in this era of this internet information, people are quite confused, like what are those right treatment for us. So what are, like, can you please enlighten, like what are those medical treatment options available for managing hair loss, like topical or surgical or non-surgical, like please can you enlighten us today with this platform.
Yes. So whenever a patient of alopecia or hair fall comes to us, हम लोग we divide the treatment in two parts, like
Hmm.
investigation and the proper treatment. So investigation includes local examination, like if there is any local infection, dandruff, severe dandruff, or what are the number of hair follicles per follicular unit, that we examine. Second is the blood investigation. Blood investigation plays a very important role here to analyze the nutritional state of the patient, and also if there is underlying disease or not. Like in blood investigation, we prescribe hemoglobin investigation, vitamin D level, vitamin B12 level, thyroid profile, and any other required test if we think that is important at that stage of time. Then the comes proper treatment. Proper treatment. So treatment is divided into like 3 to 4 parts. First is the oral, then topical, some procedures are there, and the fourth number is the surgery. So in oral treatment, nutritional supplements comes first. Nutritional supplements containing the right amount of vitamin A, B, C, D, and E, and nutrients, micronutrients, elements like zinc, selenium, iron. Or then second comes the, or there are also oral minoxidil, oral finasteride. What does minoxidil does is increases the blood supply over the scalp. So in that case also it helps in hair rejuvenation. And the third one is the oral finasteride, which is alpha reductase inhibitor. So it mostly useful in male pattern baldness and alopecia which a female encounter after menopause. Then second comes the topical medications. So one FDA approved medication is the minoxidil in topical solution or foam base or lotion base minoxidil lotion or solutions. So along with this, there are many new topical solution which has come in the market. Some phytochemicals like procapil, capexil, redensil, caffeine. These are also used in hair fall and alopecias. Then there are also stem cell growth serum has also come in market. So these are the options in topical treatment. Then the third one is the procedures. Procedures, mostly what we do is the platelet rich plasma and growth factor concentrate. In both of these conditions, you require patient's blood. We draw the platelet rich plasma and then we inject or do mesotherapy with these solutions over the patient's scalp. Again, growth factor concentrate is a bit advanced procedure where the growth factor concentrators are already provided in the tube, and then we will get a better results with GFCs. Then fourth one is the surgery. In surgery, the hair transplant, all we know, is the ultimate. So there is particular set of patient in which surgeries are required. There is type 3 or type 4 baldness, male pattern baldness. In such cases, hair transplant is advisable. So yeah, these are the treatment options present.
Okay, so there are like wide variety of treatments
Yes,
available,
yes,
and
according
the
to patient profile. Yeah.
yeah, so it's like the way you said कि root cause के हिसाब से treatment होते हैं, so it's better कि हम internet information से अपना treatment खुद ना ढूंढें, it's better we go to the doctor.
Yes, yes.
Okay, that's very interesting, doctor. So, doctor, like now that we know like these treatment options, and you also mentioned so many like caffeine and other stuff. So, there is one word called nutraceutical, which is getting a lot of focus nowadays, and many people are jumping to this word and trying to buy those stuff. So, what are these nutraceutical, and what is this role of this nutraceutical in hair health?
Nutraceuticals are basically food derived nutrients that many companies are making, and like it's contain important vitamins, minerals, micronutrients. Vitamin like vitamin B, B3, B5, B7, B12, and vitamin C, vitamin A, vitamin E. So in these nutraceuticals, a correct amount of vitamin minerals like zinc, selenium is provided. But yeah, like आप इसके बाद भी आप खुद से खरीद के नहीं खा सकते. Whatever is required, you have to consult a doctor. अगर for example आप खा रहे हो खुद से खरीद के, पर एक्चुअली प्रॉब्लम है आपको आयरन डेफिशिएंसी एनीमिया है, लेकिन उसमें एक एवरेज अमाउंट ऑफ न्यूट्रिएंट्स दिया हुआ है. इट विल नॉट हेल्प. थोड़ा कम होगा, पर रूट कॉज आपका ट्रीट नहीं हुआ. अब आप ये खा रहे हो बट यू आर हैविंग सम थायराइड डिसऑर्डर. सो ये सब ट्रीटमेंट के बाद ही आप हाँ न्यूट्रासिटिकल्स ले सकते हो. इट्स लाइक वी ऑल्सो गिव, बट according to the patient requirement. I mean, everybody can't go for it.
ओके सो लाइक खुद से खरीद के एंड बिना किसी इंफॉर्मेशन के अपनी बॉडी का यू शुड नॉट पुट इन समथिंग व्हिच इज नॉट
No, no, no.
okay. So that's very nicely said, doctor. But doctor, like there are so many like phytoconstituent and those herbal products which says that it can help managing alopecia, it can promote hair growth. So what is the fact behind this? Do they really promote hair growth?
Like herbal products, like what?
Like plant extract or phytoconstituent or grape seed or omega-3 fatty acids.
Like omega 3 फैटी एसिड, ग्रेप सीड, ये एज अ होल आपके बॉडी हेल्थ के लिए लोग यूज करते हैं. उसमें
Hmm.
स्पेशली हेयर के लिए ग्रोथ प्रमोशन में बहुत लिमिटेड डाटा है. डाटा उतना है नहीं. बट हाँ,
Hmm.
एज अ बैलेंस न्यूट्रिशन, क्योंकि ओमेगा ये जो है, ये सब इंपॉर्टेंट फैटी एसिड्स है जो हमारे नॉर्मल डाइट में हम मिस कर जाते हैं।
Hmm.
वेजिटेरियंस फिश नहीं, मतलब नॉन वेज नहीं खाते तो वो मिस कर जाते हैं। तो ये
Hmm.
सब इंपॉर्टेंट फैटी एसिड्स है जो हमारे डाइट में होना चाहिए।
Hmm.
बट हाँ, स्पेशली फॉर हेयर और हेयर ग्रोथ पे कितना इम्पैक्ट डाल देता है ये, इसका कोई
Hmm.
एग्जैक्ट डाटा भी है नहीं, मतलब बहुत लिमिटेड स्टडीज हैं इसके लिए।
ओके। सो डॉक्टर, इन सब सप्लीमेंट्स के ऊपर एक चीज और होती है जिसे आरडीए कहते हैं। सो what is that RDA, and is it required to take these as well, like gender RDA requirements? So can you please let us know like what is this and
So RDA is recommended daily allowance of nutrition.
mm-hmm,
Um, yes, RDA is what we call a balanced diet. Like you
mm-hmm,
have to take 1200 kilocalorie of carbohydrate, protein 4 gram. ये सब RDA advised है. But हाँ,
mm-hmm,
the nutrition supplements or nutraceuticals that we get from market, it is not
mm-hmm,
like it doesn't follow RDA.
mm-hmm,
Okay. सो
mm-hmm,
आरडीए उसके अलावा क्या होता है कि आपको एवरेज दे रहा है।
mm-hmm,
आप लेके मार्केट से लेके वो खाओगे तो आपको एवरेज न्यूट्रिशन जो रिक्वायर्ड है वो दे रहा है। बट व्हाट इज अबव दिस आरडीए इज, फॉर स्पेशली फॉर द हेयर लॉस, इज exact root cause. If you are having some vitamin B12, vitamin D deficiency, so you have to take medications for that also,
mm-hmm,
along with these nutritional supplements. Then only it will work. Yes, RDA, a balanced diet is very important for a good healthy body, and in a good healthy body, a healthy mind and a healthy hair will reside. But along with it, if you are having some acute deficiency, then alone, depending upon the RDA or balanced diet, it will not work. You have to take extra medications or nutritional supplements for that also.
okay. So RDA is very important to take care of it. कुछ ऊपर कुछ नीचे हो जाए तो lead to lot of
Yeah.
other problems. ओके, इंटरेस्टिंग डॉक्टर। सो डॉक्टर लाइक हमने न्यूट्रिशन की बात कर ली, लाइफस्टाइल की बात कर ली, ट्रीटमेंट की बात कर ली। अपार्ट फ्रॉम हेयर लॉस, एक दूसरा वेरी कॉमन प्रॉब्लम जो हम सब फेस करते हैं इज डैंड्रफ। सो क्या डैंड्रफ से हेयर फॉल हो सकता है?
Dandruff, yes, dandruff will obviously cause hair fall. See, like in this season, winter season, almost 90% of the patient has dry flakes over their scalp.
हम्म,
But these condition doesn't cause hair fall, but you are having chronic dandruff.
हम्म,
मोटे मोटे फ्लेक्स हैं, आपको बहुत ईचिंग हो रहा है, सेबोरिया हो रहा है। In that condition, yes, it will lead to inflammation, and inflammation, it will ultimately cause hair fall. So
हम्म,
if you are having like having big flakes, dry flakes, आप wash कर रहे हो, पर आपके
हम्म,
immediately, if you doing hair wash in the morning and immediately evening में आपके फिर से dandruff full fledged आ जा रहा है, तो इन
हम्म,
सब कंडीशंस में एक विशियस साइकिल होता है। क्या होता है, पेशेंट बोलते हैं कि मेरे को डर लग रहा है कि मैं अगर बाल धोऊंगी तो वो फ्लेक्स वापस आएगा और मेरा हेयर फॉल और ज्यादा होगा। देन द
हम्म,
स्ट्रेचिंग, द स्क्रैचिंग, द स्ट्रेस, it will go into a vicious cycle, and hair fall will ultimately increase and increase. So yeah,
हम्म,
dandruff, and mostly what I encounter,
हम्म,
mostly people go for home remedies for these dandruff. Like they are applying lemon juice over the scalp, or they are applying oil over the scalp, because they
हम्म,
think like temporarily oil will hide the scales. But what happens in turn, oil increases the sebum storage or sebum production over the scalp, and the
हम्म,
dandruff, which is caused by a fungus, will ultimately increase and increase.
हम्म।
So yeah, dandruff causes hair fall.
ओके। सो हेयर लॉस के साथ साथ हमें डैंड्रफ का भी ध्यान रखना चाहिए, इंक्लूडिंग सो दैट वो डैंड्रफ की वजह से वी डू नॉट लीड टू हेयर फॉल सिचुएशन। सो डॉक्टर लाइक जैसे शुरुआत में भी हमने बोला और अभी भी ये है कि these days even younger people are having a lot of hair loss, and कुछ लाइक इंटरनेट भी कहते हैं कि स्ट्रेस की वजह से हो रहा है ये सब। सो व्हाट इज behind this? Is there any impact of stress on hair health?
स्ट्रेस का इम्पैक्ट तो है, डायरेक्टली इनडायरेक्टली है। जब whenever a person goes through stress, any kind of stress, like be it a mental stress or a physical stress, like your body, your brain start acting over the important organs of the body. And in such stages, which what falls back is your hair, your nails, because whenever you are in stress, you don't take your diet correctly. Or like for example, uh, 14 to 16 years old students are having their exams. So in that, खाने का ठीक नहीं, sleep cycle get disturbed, nutrition get disturbed. So what happens in such cases, uh, a term called telogen effluvium, like after acute stress, after 3 to 5 months, patient comes like there is sudden increase of hair fall. When we inquire about like what happened in last 6 months, तो ही और शी सेइंग दैट हम मैं बीमार थी या मेरा एग्जाम था, बट वो 4 मंथ पहले की बात है। बट यस, बट जो टिलोजन स्टेज है, विच इज द रेस्टिंग स्टेज ऑफ आवर हेयर, इट एक्चुअली इट्स ड्यूरेशन इज 3 to 4 मंथ। सो जब इसका रेस्टिंग स्टेज पार होता है और आपका उस स्ट्रेस के समय आपके एनर्जन टिलोजन में कन्वर्ट हो गए थे, तो 3 to 5 मंथ्स के बाद वही हेयर गिरते हैं और हमें लगता है कि अचानक से क्या हुआ।
क्या हो
सो यस, और ये तो मेंटल स्ट्रेस की बात हुई। देर इज वन मोर टर्म कॉल्ड फिजिकल स्ट्रेस, लाइक एनी काइंड ऑफ इन्फेक्शन, you met an accident in such condition, or like small or big events in your life, uh, miscarriage, abortion, or delivery. In these cases also, at that point of time, what falls back or what is nutritionally deficient is your hairs. So after 3 to 5 months, you will get an increase in the hair fall. And for that, but what is good about this conditions is like it, these are manageable condition, because आपका वो स्टेज का टेलोजन गया, आप सही से ट्रीटमेंट लो, आपके हेयर वापस आ जाएंगे। थोड़ा पेशेंस रखना पड़ेगा, पर हेयर आ जाएंगे। सो द हेयर फॉल फॉर स्ट्रेस, बी इट मेंटल और physical, if you get a right treatment in right time, there is like 80 to 90% chances your hair will come back.
Wow, so many like life events can lead to hair fall and हम ध्यान नहीं देते हैं और फिर होने देते हैं, ट्रीटमेंट नहीं लेते हैं, फिर वो बहुत ज़्यादा हो जाता है।
Yes.
इंटरेस्टिंग। सो डॉक्टर लाइक एक घरेलू नुस्खा जो कि हम स्ट्रेस में होते हैं तो हमारी हर मदर एंड दादी सब अप्लाई करती हैं इज ऑयलिंग हेयर एंड जैसे भर भर के लगाओ, लगा के सो जाओ, बाल स्ट्रॉन्गर एंड थिक करोगे, बहुत घने और लंबे हो जाएंगे। सो व्हाट इज द फैक्ट बिहाइंड दिस ऑयलिंग हेयर इज boon or a ban?
Like oiling, what we can say is a cheap conditioner. Uh, आप oiling, you can do oiling, but do it over your hair shaft. What happens if you do oiling over your scalp, and especially I have seen like many people are doing at night time and then doing washing their hair after 1 or 2 days. So in such condition, what happen? It will first of all, if you are using any treatment for hair fall, it will not penetrate your scalp because there is a thick layer of oil over there. Second one, if you are going outside, you are having outdoor activities, it will attract more and more pollutants. Third number, if you are having issue like dandruff or seborrheic dermatitis, so it will increase it furthermore. So what can you do? I'm not saying that oiling is bad, but do it over your hair shaft, like putting moisturizer over your body. Your hair shaft, like many people are having frizzy hairs, so you can do it over hair shaft. Do 1 or 2 hours prior to shampoo. So in such, and also like oiling have a de-stress effect. Massage करने पे अच्छा लगता है. It will increase blood supply for a like minimal amount of time. So you can use it 1 to 2 hours before shampoo, but don't. I would suggest don't make it a like habit of doing it 1 or 2 days prior and taking मतलब going with oily hair outside. Avoid over scalp. Do over your hair shaft. That's okay.
ओके, सो लाइक ऑयलिंग इज लाइक अ लिटिल बिट ऑफ कंडीशनिंग काइंड ऑफ, इससे ऐसे नहीं है कि बाल लंबे हो जाएंगे या ग्रो करने लग जाएंगे।
नहीं, उल्टा आप
And
कुछ यूज कर रहे हो अगर हेयर फॉल के लिए तो वो काम नहीं करेगा.
okay, okay, interesting. So, doctor, now my favorite part. Can you give us some important tips for healthy hair?
Uh, so important tips, first of all, which is the most important cause, nutritional deficiency. So important tip is you have to eat well, sleep well, maintain your lifestyle. If a patient having smoking or drinking habit, you have to cut off those if you want a good healthy hair. So yeah, eating and lifestyle is first. पहला यही है आप. Then second comes like customize your shampoo. Okay. If you are having a dry scalp, then use mild cleansing shampoo. If you like, I would not suggest to salon procedures. Many people like मेरे फिजी थे तो मैंने स्मूथनिंग कराया, केराटिन ट्रीटमेंट कराया. So all these salon procedure ultimately damage your cuticle because all of the that's heat directly affect the disulfide bond over your hair shaft and damages the cuticle. So I would suggest try to avoid those salon procedures. And if you do so, then use like shampoo according to your hair. If you are having dry scalp, if you are having seborrheic dermatitis, dandruff, then use a like correct type of anti-dandruff shampoo after consulting your dermatologist. So, like correct shampoo, correct condition. Third one is like regular cleansing. You are using correct product, but you are using it once in a week. तो ये फिर दिक्कत है. जैसे आपका फेस वॉश आपको चाहिए डेली, आपके हेयर को भी वॉश चाहिए एटलीस्ट थ्राइज अ वीक, 2 to 3 times a week. So clean your hair regularly. Then regular trimming, good grooming of your hair. Trim your hair every 2 months. You have to trim your hair. And yeah, and if you feel sudden increase in your hair fall or some kind of pattern baldness, then consult your dermatologist immediately.
Wow, doctor, thank you so much for so much of healthy tips and grooming of our hair is also important, including like people only focus on their skin, but even our hair is important, and I think rightly said we should maintain our personal hygiene for hair also. So, doctor, this discussion was very informative, and I'm sure the viewers have found the session very helpful. Can I take one or two live audience questions,
Sure, sure,
please?
sure.
Yeah, so the first question from our audience is Hi, doctor. I have PCOD and fibroids in my uterus, and I'm having extreme hair loss. Is it because of PCOD or fibroids in my uterus?
Like these two conditions, PCOD and fibroid, these are the most common gynecological condition that our reproductive age women are experiencing nowadays. So, like इन दोनों conditions का pathology अलग है, ठीक है? Fibroids are hormone dependent tumors of uterus, which is a benign tumor, and it really doesn't affect your health status or nutritional status or hair fall. But on the other hand, PCOD, it's completely hormonal issue. Like it affect multi-system of your body. So PCOD obviously it increases the androgen sensitivity, insulin like growth factor increases in the body. So in this is the condition PCOD where a female experiences sudden increase in the hair fall. If you take right treatment, maintain your diet, cut off your oil or junk food, and take right amount of nutrition, see your gynecologist or endocrinologist, whoever you are taking medicines from. So consult correctly. Yeah, you have to come to us also for taking the right amount of pills or any topical medications required. Yeah, PCOD patient needs treatment for hair fall.
Okay, so PCOD और uterus issues में भी hair fall हो सकता
होता
है,
है, होता है.
and they should go to the doctor for this also. Okay, and interesting, doctor. Another question from our viewer is, doctor, क्या vitamin D से भी hair loss हो सकता है?
बिल्कुल। विटामिन डी हम लोगों को जैसे आज तक मैक्सिमम लोगों को लगता है इट्स फॉर बोन हेल्थ, पर नो, इट एक्चुअली इफेक्ट्स आवर स्किन हेल्थ, आवर हेयर हेल्थ, नेल्स के लिए, पूरे एज अ होल कंप्लीट बैलेंस्ड बॉडी के लिए विटामिन डी बहुत नेसेसरी है। और विटामिन डी का ऐसा भी पेशेंट्स मैंने देखा है जिसके सब ठीक है, बस विटामिन डी डेफिशिएंसी है, 3 मंथ्स विटामिन डी का कोर्स दिया एंड वो एकदम मतलब बिल्कुल सही हो गया। सो
हम्म,
विटामिन डी डायरेक्टली इफेक्ट करता है। और न्यूट्रिशनल डेफिशिएंसी में अगर मैं बोलूँ, आयरन के बाद कुछ आता है तो विटामिन डी आता है
ओके
हेयर लॉस के कॉजेज में।
ओके, interesting, doctor. Another question from our viewer is, डॉक्टर आयरन की डेफिशिएंसी क्यों इतनी हो रही है? मैं तो सब कुछ खाती हूँ फिर भी मुझे हो गई है। और कोई वन पॉइंट है आपसे कंसल्टेंसी करने का जहाँ कॉल करके आपका अपॉइंटमेंट मिल सकता है? और मुझे आयरन डेफिशिएंसी है, कुछ उपाय बताएं, और मुझे हेयर लॉस भी हो रहा है।
देखिए, आयरन, देर इज मल्टीपल कॉजेज ऑफ आयरन डेफिशिएंसी।
हम्म,
ओके, if he or she is, if she is female, then you are like, you are having high bleeding or not, your cycles
हम्म,
are regular or not, you are eat, she is mentioning that she is eating correctly, but like आपके लाइफ में एक इवेंट हुआ 3-4 मंथ्स बैक जिसमें आपको एक्यूटली आयरन का डेफिशिएंसी हुआ, बट
हम्म,
उसके बाद आप क्या कर रहे हो, अपना डाइट मेंटेन कर रहे हो, आप सोच रहे हो मैं आयरन रिच फूड खा रही हूँ, पर वो मेरे ब्लड लेवल्स में सही क्यों नहीं हो रहा है? पर
हम्म,
वो जो एक आयरन स्टोर आपका गया उस फेज में, उसके लिए आपको कुछ एक्स्ट्रा विटामिन या एक्स्ट्रा आयरन की जरूरत है, जो कि आपको वाया मेडिसिन से मिल सकते हैं। उसमें आप मतलब अभी डाइट ठीक करके प्रीवियसली जो आपका स्टोर गया उसको आप सही नहीं कर सकते।
हम्म,
और भी कॉजेज होते हैं। और एक बहुत कॉमन कॉज है इंडिया में, वर्म इन्फेस्टेशन, कि राउंड वर्म होता है जिसकी वजह से भी डेफिशिएंसी, आयरन डेफिशिएंसी, आपका फूड जो है वो सही से मतलब आपके डाइजेस्टिव ट्रैक्ट से एब्जॉर्ब हो रहा है कि नहीं। तो ये
हम्म,
सब बहुत इंपॉर्टेंट कॉजेज हैं आयरन डेफिशिएंसी एनीमिया के। सो या,
हम्म,
और कंसल्ट करने के लिए मेरा रोमा, आप गूगल पे सर्च कर सकते हो, रोमा हेल्थ क्लिनिक, वहाँ पे नंबर अवेलेबल है, आप वहाँ से कंसल्टेंसी कर सकते हो।
हम्म। So you can always Google doctors from Roma Health Clinic
क्लिनिक।
and call it's in Kolkata.
यस यस
Okay, interesting. And even gut health is important for
यस।
iron. That's very rightly said, doctor. So I'll quickly take one last question from the audience because we are running out of time. So this person is asking, "Hi, doctor. My daughter is 12 years old and she's having a lot of hair, and this is a very common question which is asked by all the parents, and the younger girls are getting a lot of white hairs. And is there any solution for it? Can we reverse it or control it or stop it?"
लाइक वाइट हेयर्स, मुझे मतलब ये एक प्रॉब्लम है, इसको केनाइटिस बोलते हैं। ये एक ऐसा प्रॉब्लम है जिसमें मतलब जो कॉजेज है वो लिमिटेड कॉजेज हैं, जिसमें मोस्ट इम्पॉर्टेंट कॉज इज द जेनेटिक्स। but genetics, we can't control. Like if we take patient history, like if his or her grandfather or grandmother is having early graying of hair, in such
Mm,
cases, yes, he or she has got same genes and she's also experiences the same. So in such cases nothing much we can do there. Second is hormonal issue, mostly thyroid disorders. So check for the hormone profile, whether the thyroid is normal or not. If you take medicines for that, आपके जो बाल white हो गए, वो तो मतलब थोड़ा doubtful है उसका, but yeah, it will it will reduce the further progression of the graying of the hair. And third number obviously is the nutritional deficiency. इसमें mostly what we give is the calcium pentothenate, which is the most common mineral which we get in canitis patient. So this supplementation also reduces the progression, but the already gray hair, in my experience, very few patients, like 10 to 20% पेशेंट्स में होता है कि वो जो ग्रे हो गए वो वापस से ब्लैक हो जाए। बट हाँ, इफ यू टेक अ लॉन्ग ट्रीटमेंट एंड take your medicine correctly, then progression can be reduced.
Okay, so sticking to the medical adherence is very important, and then you
Yes.
can find the result coming out. Very interesting, doctor. So this discussion was very informative, doctor. Can would you like to give any other take-home message or any other suggestion to our viewers today?
Yes, I just want to say two things. First of all, don't take much stress regarding hair fall. If you are having, consult a dermatologist or trichologist, get it treated. But yes, अगर आप treatment ले रहे हो, so you should give your doctor some time. What मतलब मैं जो experience करती हूँ, एक महीने से खा रही हूँ, मेरा क्यों नहीं सही हो रहा है? तो ऐसा नहीं होता। आपका प्रॉब्लम, हेयर का प्रॉब्लम जो अभी आपको दिख रहा है, इसका जो कॉजेज है, इसका जो रूट कॉज है, वो 2 इयर्स पहले, 1 ईयर पहले से शुरू हो गया था। तो वो उस चीज को आप एक महीने में नहीं ठीक कर सकते।
Mm.
So at least give 6 to 8 month time to your doctor and then wait for the results. Take your medicine correctly, have patience, and I'm sure the problem can be taken care of.
Wow, doctor. So early intervention and patience is the key to get a healthy and wonderful hair and your confidence back. Thank you so much, doctor. And I really love talking to you, and I want to talk more, but time does not permit us. But thank you so much for sharing all the expertise and answering all the questions of the viewers. And I'm sure the viewers have loved the show. A lot of people ask many questions I could not cover, but if our doctor have some time in future, we can create more awareness about hair, skin, and other problems about dermatologists. And until then, doctor, I hope I see you soon, and you should take care and have a very nice day.
Thank you so much. Thank you, Mona.
And thank you so much, viewers, for joining us today. And we are signing off for today. And see you again. Bye bye, doctor. Take
Bye
care.
bye.